Hello everyone, my name is Nikita, and in today's video topic we are going to discuss about general coding guidelines. So first guideline is locating a code in ICD 10 CM. Find the main term and subterm first, then locate in alphabetic index. Always use alphabetic index to locate and a tabular index to verify the code. Then next, because tabular provides full coding along with the literality and with the character with seventh character, add a dash at the end of alphabet index indicates the additional characters are required. Level of detail in coding, diagnosis codes are to be used and reported at their highest number of character available. A 3 character code is to be used only if it is not further subdivided. A code is invalid if it has been coded to the full number of characters required for that code, including 7 character if applicable. Then sign and symptoms. Codes that describe symptoms and signs as opposed to the diagnosis are acceptable for the reporting purpose when a relative definite diagnosis has not been established by the provider. Sign and symptoms don't have value as such, hence we code only diagnosis, that is high potential, a high adjacent condition category. Then fourth, condition that are an integral of the disease process. Sign and symptoms that are routinely assigned with a disease process should not be assigned as additional codes unless otherwise instructed by the classification. Additional signs and symptoms that may not be associated routinely with the disease process should be coded when present. Then multiple coding for the single condition. More than one code should be assigned to describe the full conditions. Use additional code, that is intracranic and intraspinal abscess and the granuloma use additional codes 895 to B97 to identify the infection agent. G30 Alzheimer's disease include the Alzheimer's dementia, senile and presentile forms. Then 6, acute and the chronic conditions. If the same condition is described as a both acute and chronic and the separate sub-entries exist in the alphabetics index at the same identification level, code and sequence the acute code first. Example, enteritis, acute diarrhea hemorrhagic or non-infective K52.9, chronic non-infectional K52.9, ulcerative and colitis ulcerative. Then 7, combination code. A combination code is a single code used to classify two diagnoses or the anemia, leukopenia, thrombocytopenia, a diagnosis with an associated secondary process, a diagnosis with an associated complication. Example, diabetes with the hypoglycemia and cancer surgery with infection. Then sequela. A sequela is the residual effect that condition produce after the acute phase of an illness or injury has terminated. There has no time limit on when a sequela code can be coded first. Then the code for the acute phase on illness or the injury that lead to the sequela is never used with a code for the late effect. The appropriate 7 character is added to each code, the forms and subcategory. Initial encounter for fracture, subsequent encounter to fracture with routine healing, subsequent encounter for the fracture with delay healing, subsequent encounter fracture with a non-union, and subsequent encounter fracture for with a malunion and the sequela. Then 8, laterality. Some ICD-10 CM no codes include laterality specifying whether the condition occurs on the left, right or the bilateral. If the condition exists in the both sides and no combination code found, assign separate code. If combination found, assign it. If laterality is not given, then code unspecified. Then borderline diagnosis. If the provider documents a borderline diagnosis is the time of discharge, the diagnosis code is confirmed. If a sub-entry is found, that is borderline diabetes. If sub-entry is not found, that is a hyperlipidemia. Then status codes, reversible gastrostomy and irreversible nephrectomy. Then use additional codes to identify delirium if applicable, dementia with behavioral disturbance, dementia without behavioral disturbance. Then things to do before coding. a proper visit, see patient details, look for the physician name, valid, discriminative, valid signature, and face to face encounter. Then, convection for the ICD-2 guidelines. These are the incorporate in alphabetics and tabular list of the ICD-10 CM. First, alphabetic and the tabular list contain tabular list terms and their corresponding codes. Structured list of code divided into the chapter based on the body system and condition. Alphabetic list divided into following parts: the index of disease and injury, the index of external causes of injury, the table of neoplasm, the table of drugs and the chemicals. Then format and structure. Tabular list contain categories, subcategories and codes. For repeating purpose, we only use codes. Codes may be 3, 45, 6 or the 7 character. A code that can be applicable 7th character is considered invalid without 7th character. Then in order to fulfill code requirement, we have to add a placeholder, that is X. Example, unpacified fracture of shaft of femur is coded as a 572.30XA. Then abbreviations, alphabetical and the tabular index abbreviations. First one, not elsewhere classifiable and other specified. This abbreviation in the alphabetical index represent the other specified when a specific code is not available for the condition in the alphabetic index, directs the coder to the other specified code in tabular list. Example, subclinical hyperlipidemia. Then not otherwise specified, that is unspecified. This abbreviation is equivalent to the unspecified. Example, diabetes type 1 and type 2 is not mentioned. Then punctuation. First one is a bracket. A tabular index is used to enclose synonyms, alternative wordings or the explanatory phrases. In the alphabetical index is used to identify the manifestation code. Example, disease along with the symptoms. Example, Alzheimer's disease with a dementia. Then parenthesis, it is used to enclose the supplementary words that may not affect the code number. They are non-essential modifiers. Important, in the ICD-10 CM alphabetic index, under the main term enteritis, acute is not essential modified and the chronic is a sub entry. In this case, the non-essential modifier active does not apply to the sub-entry chronic, and the word and should be interpreted to mean either as a and or when it's appear in the title. Example, tuberculosis of the bones, TB of joint, TB of bones and joints. With, the word with or in should be interpreted to mean associated with or due to when it appears in a code title. The alphabetical index, either main term or the subterm, or an instructional note in the tabular index. Example, diabetes with the cataract. Inclusion, notes and inclusion notes. Exclusion and the inclusion notes. This note appears immediately under the 3-character code title to further define or give example of content of category. These terms are the conditions for which that code is to be used. These terms may be synonyms. In case of other specified code, the term are list of various conditions assigned to the code. Activity, hypertension, cardiomegaly, final combination code. Example, I-98 essential primary hypertension, inclusion high BP. Exclusive 2 essential primary hypertension involving vessels of brain. Then all hypertensive heart diseases inclusive any condition I-51 to I-4 to 15 due to the hypertension. Then exclude notes, etiology and manifestation convention. Certain conditions have both an underlying etiology and the multiple body system manifestation due to the underlying etiology that requires the underlying condition to be sequenced first if applicable, followed by the manifestation. They are as follows: see also, code first, code also, and use additional codes. So first, see, the C instruction following a main term in alphabetical index, another term should be referred. See also instruct that there is another main term that may also be referred that may provide additional alphabetic index entries that may be useful. Then code first, when there is a code fixed note and an underlying condition is present, the underlying condition should be sequenced first if known. Then code also, A code also note instruct that two codes may be required to fully describe a condition, but this note does not provide sequencing direction. Use additional codes. Certain conditions have both underlying etiology and the multiple body system manifestation due to the underlying etiology. For such condition, ICD-10 has a coding convention. Thank you.